And I'm here today with Dr. William Pirl, who is a psychiatrist and an expert on issues related to fatigue. Bill, thanks for being with us.
Oh, my pleasure.
So let's talk about that. People are treated for cancer, and I think we all sort of might expect that they would feel tired. But how is, when we think about fatigue, how is that the same, different as, oh, I'm just tired?
When people without a medical illness get tired, they can rest or sleep and it goes away, whereas fatigue in people who have cancer or cancer survivors, it doesn't do that.
If you're seeing a patient, a cancer survivor who comes to you and said, I was treated a year ago and I'm fatigued, I just don't have the energy, what are some of the questions you'd ask them to try to tease apart what's causing it?
In my experience with patients, most people have more than one reason to be fatigued, so we really try to chip away at all the different things that can be contributing to it. Probably the main things that I see in many patients are trouble with sleep, that it's estimated that about half of people who've been treated for cancer will have some sort of sleep disturbance, so really working on getting them sleeping better, either through behavioral interventions to get them to sleep better or sometimes through medicines, lays sort of the foundation for that. Also, many people are deconditioned after their cancer treatment and really need to build their strength and stamina back. So I usually have most people I see physical therapy to get an exercise regimen that they can do to help build their strength and stamina back. Other people may have things like anxiety or depression that can also be contributing to their fatigue, and sort of addressing that by either through medications or through counseling can be helpful. And then again, there are other people who may have a variety of other reasons, like low thyroid hormone that can sometimes develop after cancer treatments, people who may have exacerbation of their other medical disorders, like heart disease or pulmonary disease. So you really have to look at everyone on an individual basis, but I'd say those are some of the main things that I see.
Depression and fatigue sometimes look similar to each other. How do you try to tease out how they're contributing?
I think that's a really hard thing to do, but some of the things that I use to try to see who might have fatigue versus depression is that people who have fatigue can have some variation in their energy level and may have some good periods or good days, and during those times people can actually enjoy things or do things that are enjoyable to them and get pleasure out of that. Mm-hmm. Someone who's depressed really can't do that and just sort of feels like they're going through the motions when they would do something that's enjoyable. Also, there seems to be a difference in the patterns of fatigue in people who have depression versus people who have cancer-related fatigue. People who have depression tend to wake up in the morning feeling overwhelmed and not sure how they're going to get through the day and feel tired, and that gradually gets better as the day goes on, whereas people who have cancer-related fatigue tend to have an exaggerated pattern of what people usually have, of a dip in their energy sort of mid to late afternoon that then comes up later. So sometimes even looking at the pattern of it.
In terms of a spectrum of treatment, from very simple kind of interventions to more complicated, how would you describe sort of the different steps?
I guess it depends on how fatigued somebody is. If somebody has very severe fatigue, I may approach that differently than what most people come to see me who have moderate to mild fatigue. In those people, I would probably start by seeing if there's anything that I could fix, and then after fixing any medical things, I usually recommend exercise for almost everybody, and sometimes have them see a physical therapist to get a good exercise regimen that's good for them. Also, addressing any sleep disorders or emotional aspects that could be contributing to it are usually what I do primarily. If it seems like people are still having fatigue after fixing some of those things, I sometimes think about medicines like stimulants.
So tell us more about that if you would, because patients ask about it.
So it's usually recommended to try to fix anything that you can fix before starting stimulants. Stimulants are medicines that are used for other things in psychiatry, like attention deficit hyperactivity disorder. But in people who have medical illnesses and fatigue, they can sometimes be helpful to boost energy as well as boost mood and appetite. So they're sometimes used after other things have been ruled out that can be fixed. I really think the first thing to do is to talk to your primary care provider, whether you're seeing an oncologist or whether you're seeing your primary care doctor now, is to really talk with that person about what your experience is, because there can be many things contributing to the fatigue that really need to be identified so they can be helped.
It's been a really interesting session talking about fatigue and cancer survivors, and I want to thank Dr. William Pirl for being with us. Thanks,
You're
Bill.
welcome.